Good afternoon. Today, October the 30th, Baltimore City has 17,841 reported cases, 116 people hospitalized with COVID-19, and we're at 462 deaths. Our nation is reporting record highs, surpassing what we saw over the summer. I'm up here every week to ensure our residents have the most up-to-date and accurate information, so in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in the city of Baltimore. I want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov, and that's at coronavirus.baltimorecity.gov. There, residents can find real-time data for Baltimore City as well as locations for where they can get tested. We're still in a pandemic, one that's built to spread rapidly in large groups. The coronavirus pandemic hasn't gone anywhere, and we need all of our residents and visitors to act accordingly. Wear a mask when out in public, watch your distance to others, and wash your hands often. We have been very successful throughout this pandemic in avoiding large outbreaks, but we are coming to a time of year where the risks are going to increase. The weather is getting colder and people will want to spend more time together indoors. A lot of the cases we're seeing are from indoor family gatherings. We need to be even more cautious to keep our loved ones and our neighbors from getting sick and dying. We know that the next few days have several major events: Halloween, a Ravens home game against the Steelers, and of course, Election Day. The choices we all make over the next few days will impact what our Thanksgiving will look like. If you're planning to celebrate Halloween, I urge you to do so safely. Our health department has put out guidance on their website and social media. Please follow that. Wear your mask, not the costume mask, but your PPE. Practice social distancing, avoid large gatherings, and avoid spending extended time at indoor gatherings. If you're planning to cheer on the Ravens, find ways to do so that are safe in this pandemic. Don't go tailgating and wear a mask. And I want to say that again. Don't go tailgating and wear a mask. The Ravens already said no tailgating, so please, no tailgating. And practice social distancing. And if you're planning to vote, and I hope everyone is planning to vote, follow the rules at the voting sites, and please wear a mask. If we want to have anything resembling a normal Thanksgiving, we have to be vigilant now. I want to say that again. If we want to have anything resembling a normal Thanksgiving, we have to be vigilant now. I am continuing to work with the Health Commissioner, Dr. DeRosa, and our public health experts to review data and determine when it is safe to further loosen restrictions, or if needed, tighten them back up. We are continuing to prevent deaths and life-altering illness by making decisions based on the data. Again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. And as always, we will continue to monitor the data daily. Also, remember to get your flu shots. Don't take chances with your life or your families. Get your flu shots today. Now I will ask Baltimore City Health Commissioner, Dr. Letitia DeRosa, to update you on our COVID response and how we are supporting residents and families in our city.
Good afternoon, and thank you, Mayor Young. Every day, the Baltimore City Health Department, in partnership with the Mayor's Office of Performance Innovation, updates the coronavirus dashboard at coronavirus.baltimorecity.gov. We do this to ensure that Baltimore residents can make informed decisions about the risks of COVID-19 in our community. I would like to take this time to highlight this data and stress the concern that we have about increasing numbers of new cases we're seeing across the city. As our dashboard shows, we're now averaging approximately 82 new cases per day. This is an increase of 120% compared to where we were 4 weeks ago. Our current 7-day averages for new cases is 13.6 cases per 100,000 people. Our positivity has also increased by 80% in the last 4 weeks, with a new 7-day average of 2.9%. As it stands, our mortality rate, or number of deaths, has remained low, but keep in mind that deaths lag behind when it comes to our data, and often you might see a spike in deaths several weeks after your spike in new cases. For context, these numbers are approaching the case numbers we were seeing at the beginning of July before we peaked in early August, and before restrictions were put in place to reduce our caseload. The yellow line on this chart indicates Baltimore City's new cases per 100,000 residents, which, as you can see, has been steadily increasing. We urge Baltimore City residents ahead of the Halloween weekend, please take the threat of coronavirus seriously. There are a few new pieces of information that I would also like to share. Last week, the CDC reported 2 findings that are important today. The first, as Mayor Young mentioned, family gatherings are a leading cause of the increase in new COVID cases around the country. We can infer that many are experiencing COVID fatigue, a feeling that I also understand. We're all tired of having our movement and our ability to see family and friends restricted. COVID forced us to stay indoors in the spring and in the summer, and is now forcing us to remain away from our loved ones when we would usually be celebrating holidays together. Unfortunately, even though you are fatigued, COVID doesn't get tired. It is a highly contagious virus that spreads through close contact that we might encounter at family gatherings or in other tight indoor spaces where social distancing while wearing a mask is difficult. Last week, the CDC released updated information around COVID about what constitutes a close contact, and it stated that multiple shorter contacts throughout a course of 24 hours can also be likened to a close contact. Before, we believed that you needed to be in contact with someone for at least 15 minutes before you could catch the virus. We now know that repeated exposures, sometimes a minute or less, that are cumulative over 24 hours can lead to disease transmission. So I want to reiterate that this remains a newly discovered virus, and we are still learning new information. Please take the information we're learning seriously as you make decisions. What this means in the midst of Halloween and all the pending holidays is that we have to remain vigilant, as Mayor Young said. Unless everyone continues to follow practical harm reduction guidance, including not attending house parties, not doing the traditional trick-or-treating, and not going to parties or indoor spaces where social distancing is challenging, we will continue to see this rise in cases. Please continue to heed our guidance to keep yourself and your family safe. Yesterday, we announced the closure of the Pimlico racetrack for testing. As the city transitions to winter testing models, which will include indoor testing sites to protect both residents and employees from inclement weather, we saw it necessary to shut down the outdoor testing site at Pimlico. We are very grateful for the work and support of the Stronach Group, the Maryland Jockey Association, LifeBridge Health, the Maryland National Guard, and the Maryland Department of Health for their assistance in converting Pimlico Racetrack into the very first city-supported community testing site back in April. At that time, we were only averaging about 300 tests per day here in Baltimore. Today, we're above 3,600 tests per day, a testament to the partnerships the city has formed with our medical system, as well as our overall commitment to providing testing services to meet residents where they are. As you can see from the chart below, testing in Baltimore City is varied, and the closing of Pimlico in no way implies that we are reducing our testing capacity. It's going to be a cold winter, and we need to ensure that our staff and our residents are protected from the elements. As we continue to test thousands of residents in Baltimore City each day, please visit our website to learn more about where testing sites will be available. For the residents in the Park Heights community, they can still find testing at Mount Sinai Hospital. Again, visit our website to learn of other testing sites across the city, coronavirus.baltimorecity.gov. Finally, please get your flu shot. The flu vaccine is safe and effective, and it's covered by most health insurances. If you don't have a health insurance, please visit our website, health.baltimorecity.gov/flu, to see a list of free flu vaccine clinics happening around the city. We must reduce the burden on our hospital systems should a twindemic of both COVID and seasonal flu occur. Please, please get a flu shot. If if no other year, make this the year that you commit to getting your flu shot to keep yourself and your family safe. Thank you.
Thank you, Dr. Devassa. Next, I've asked Commissioner Harrison to come and talk about preparation Baltimore Police Department is making to keep residents safe during these times. Commissioner.
Thank you, Mr. Mayor. Good afternoon. As families and residents prepare to celebrate Halloween tomorrow, the Baltimore Police Department recognizes the challenge in addressing potential crowds and ensuring safety of families. The department has canceled leave and developed a firm plan to deploy officers when and where needed. There will be in excess of 300 extra officers available to deploy to areas of need. Our officers are being deployed to be highly engaged and highly visible, and to remind people to wear their masks and to practice social distancing so we can all have a safe holiday. As we transition from the holiday to the upcoming election, our department is prepared to assist with ensuring a safe environment and the possibility of potential unrest before, on, and even after Election Day. To ensure adequate manpower, we have restricted leave to all sworn members and are working with our law enforcement agencies in preparing for any potential issues surrounding the election. We're also looking and working with the local Board of Elections to facilitate the safety of our residents in casting their ballots at local election boxes and polling locations. Our department will continue to take extra precautions to include opening an incident command room, having dedicated personnel to respond to any and all issues, and closely monitoring any information leading up to the election that may create issues affecting public safety. We have trained another 200+ officers and supervisors in mobile field force training in the recent weeks to prepare ourselves for the upcoming election. I've been working with the National Voter Protection Program, which recently put out guidelines and guidance to all departments across the country. Law enforcement will not tolerate voter intimidation or harassment at polling places. Members of our department will not necessarily be highly visible at these places, but we will be ready if needed to protect voters and to help de-escalate any tensions at any of the polls. We will be giving officers guidance in writing about proximity, especially when it comes to people who want to disrupt and to claim to be poll watchers. The Baltimore Police Department is grounded in the principle of protecting voters, and this year will be no different. We are on the side of voters, and we will protect your right to vote. Thank you again.
Thank you, Mr. Commissioner, for your tireless dedication to the residents of our city. Again, I advise everyone looking to celebrate the Halloween holiday to do so safely and responsibly. For those going to the game on Sunday, please be safe and follow all of the safety protocols. And again, tailgating is strictly prohibited under both the governor's order and my own. And for those residents planning to vote in person on Tuesday, please prepare, make a plan, and be safe while you exercise your civic duty to vote. And I would like to thank our interpreters for being here so that our people who are hearing impaired can actually know what we're saying and what we're doing in the city of Baltimore. So again, thank you, stay safe, and have a great weekend.